वो खोल देते हैं। हाँ
बस 5 सेकंड में चालू हो रहा है।
अभी देखिएगा। हाँ खोल दीजिए, बेटर है थोड़ा। अच्छा हो गया लाइव इज इट? So, hi all, I am Dr. Arundhati. Today we would be talking about breast cancer. So, when we talk about breast cancer, we need to understand four aspects of it, particularly what is our risk when we live in the Indian population, what causes breast cancer. Now, that's a big question that we face every day. What are the symptoms? How do we detect breast cancer on our own? Because when we talk about breast cancer, early detection is fundamental, and that is when the cure rate improves. Your chance of survival improves if cancer is detected early. Apart from that, what are the recent advances in treatment options? So, when we talk about the risk of breast cancer, if you see the data, there's a lot of things available on Google where they say that out of 8 women, there's chance that one woman may develop breast cancer in her entire lifetime. If you talk about the Indian subcontinent, out of 28 women, one woman has the risk of developing breast cancer in her entire lifetime. That means a woman's cumulative risk of developing breast cancer in her entire life is around 2.8%. Unfortunately, there are certain factors which are not in our control, because being women, we are more predisposed to the risk of developing breast cancer because our system is hormone driven by estrogen and progesterone. There are certain factors which are definitely in our control. One of the major factors is not taking hormone supplements without proper prescription. Also, keeping your weight in check. Because what happens is, if there is excessive weight gain, the fat which is deposited or stored in your body undergoes conversion into molecules which are similar to estrogen and progesterone, thereby increasing your risk of breast cancer. Also, alcohol is a major risk factor for breast cancer. So, if you consume around two drinks, that is around 30 milligrams of alcohol, your risk of breast cancer significantly increases by around 7 to 10%. So, occasional alcohol is fine, but not every day. And smoking, I cannot stress more about it, but yes, it's definite risk factor. Certain things like age. So now in India, we have seen a bimodal distribution of breast cancer. Most of the cases are seen in the age group of in and around 40, and the next peak comes at around 60 years. And other factors are family history. So, what do you mean by significant family history? So, anybody in your family having breast cancer or has had breast cancer, ovarian cancer, prostate cancer in males, colon cancer, to name a few, that is intestine cancer, might have some genetic mutation which might be carried forward to future generations, thereby increasing the risk of breast cancer. So, once we understand the risk of breast cancer and certain things, what we can do, what we should actually practice is a stress free lifestyle, adequate, proper diet, not much of fast food, and also regular exercise. So, by regular exercise, what we mean is 40 minutes of exercise daily is adequate to keep your weight in check. Other than that, let's understand how do we detect breast cancer. So breast cancer detection, unfortunately, should happen at home at early stage, and unfortunately a lot of people are not aware of the symptoms. What we see commonly in OPD is late presentation. Women come late to the OPD because the symptoms, the minute symptoms of breast cancer, are not causing much trouble in their life. So one thing I would like to mention is any lump in the breast should be diagnosed, should at least a woman should at least undergo a sonography, a mammography, and a biopsy before you can determine whether to keep it on follow up, or you should go for some surgical intervention. So one common symptom of breast cancer is lump in the breast. Any painless lump in the breast in the age of about 35 years warrants a biopsy and a sonography and mammography. Other than that, any nipple discharge which was not there before, but now has certainly propped up, like a watery discharge from the nipple, brown color, blood stained nipple discharge, a few of the warning signs. Other than that, skin changes, redness over the breast, itching over the nipple are few minor signs which you all should always notice. Now, how do you notice that? It's not mandatory and it's not recommended that you check your breast every day. That's not possible in day to day life. What you need to do is check your breast once a month. That is called self breast examination. There's a proper technique to it. You should visit your doctor and get yourself checked once a year, and check your breast once a month as recommended by your doctor. So which doctor should you consult? Should it be a gynecologist? Should it be a physician, a radiologist, and a surgeon? Well, I think somebody who has had proper training in breast, somebody who understands the science of breast cancer, is the someone you should visit, because misdiagnosis, false positives, and false negatives are quite common, and therefore, though I say that breast cancer is common, and though 90% of painless lumps are cancerous, there's also a fact that out of 10 patients presenting in OPD, 8 patients will have symptoms that are not related to breast cancer, and therefore, visiting a proper doctor is important. And another point I would like to mention is about mammogram. Should everybody do a mammogram? Is it really recommended? What is the harm? Does it give cause a lot of radiation exposure? Well, in US and UK, there are screening programs where women are advised to get mammogram done from the age of 50. Fortunately or unfortunately, India doesn't have such screening program. But yes, it is recommended that you get a mammogram once you cross the age of 40, once a year. And other than that, you should examine your breast regularly after your periods, after 3 to 4 days of your periods. Now, what happens when you go for a mammogram? So, mammogram is basically an X-ray of the breast. There is a plate on which your breast is placed, and it is compressed slightly, and an X-ray is taken. The importance of mammogram here is that lumps which are even less than 1 centimeter in size, which even your surgeon may not be able to feel by touching your breast or feeling your breast, such lumps or lumps even 1 or 2 millimeters in size are detected on mammogram. So that helps in early detection. The fact that I'm stressing so much on early detection is because it helps to determine the survival rate. So when we talk about breast cancer, survival, that is your chance of surviving from breast cancer, is maximum when the cancer is detected in stage 1 2 in early stage. As the stage advances, the survival comes down. Similarly, for early detection, what is recommended apart from self breast examination and mammogram is understanding your family history. So you should be able to understand if anybody in the family, in first, second cousins, in first or third, up to 3 generations, has had any type of cancer. It is recommended that you undergo a genetic counseling, meet your doctor, and find out whether you need to do any blood test to find out genetic mutation. This will help in further surveillance, in further follow up for you and your future generations. Because if breast cancer is family driven, it presents in a little early stage and can also be slightly aggressive. So, this was about the screening part of breast cancer. How do you find out what are the symptoms of breast cancer? Let's talk about the treatment. Now, the era is gone, which was around, say, 20 years back, when any type of breast cancer would warrant removal of the entire breast and the woman would end up in a flat chest. That doesn't happen now. So, if the cancer is detected early, say stage 1 or 2, if the tumor is small, we can also save the breast. By saving the breast, what I mean is we remove the entire tumor, and we also do certain oncoplastic techniques, plastic surgery techniques, so that we would be able to regain the shape and the contour of your breast to match the opposite side. This helps definitely in improving the confidence, and also it is oncologically safe. So, oncologically safe means any type of surgery you choose, whether removal of the breast or saving the breast by removing only the tumor, will not determine whether the cancer is going to come back or not. It totally depends on the type of breast cancer, because there are around 4 to 5 types of breast cancer, and depending on that, treatment is offered. Not every patient needs chemotherapy, not every patient would require radiation therapy. Yes, surgery is a mandate still for breast cancer, but in large tumors also, we can save the breast by giving chemotherapy early. By saving the breast, radiation definitely becomes mandatory, but modalities like chemotherapy, radiation therapy, targeted therapy, hormone therapy have become so advanced that all these have now become daycare procedures, and therefore treatment is usually a one-day procedure where after which a woman can resume to her normal duties. Other than that, if we really want to understand how to examine your breast, it has to be done after your periods are over, say after 4 to 5 days of your periods. You have to feel your breast, you have to examine your breast, you have to check for any changes in the direction, shape, and size of the nipple. You have to press your nipple and see, and if there's any discharge, you need to report immediately. So these were the few things I wanted to share about breast cancer. I think we can take a momentary pause and see if there are any questions. We would be open to any questions or any doubts if anybody has. Neera, can you open your questions? While we wait for questions, let's understand a little about chemotherapy. So that is something which is offered by medical oncologists, and it is not required for all patients. Even if required, it's a daycare procedure. Patient comes in the morning, gets chemotherapy, and goes home. The advantage of chemotherapy is because breast cancer, though we talk about breast cancer as a symptom pertaining to breast, it's a systemic disease. There might be few microcells which are here and there in your body, and that is why the need of chemotherapy to control the cancer or to prevent it from coming back. And chemotherapy, along with targeted therapy and hormone therapy, that is basically oral anti hormone treatment, also decreases your risk of the cancer from coming back. Radiation is, of course, in layman's term, it's the heat is given to the chest wall or to the operated area of the breast to prevent any microcells or cancer cells from going back. So these are all the treatment modalities that are offered. Unfortunately, breast cancer treatment doesn't end in a week's time like a flu or something. The treatment is long. It might go on for say 4 months to 8 months, but it is 100% curable. So a cancer detected in stage 1, 2A, 2B, 3, 3A, 4B, the cure rate is almost 100% provided the patient, the woman follows the timeline given by the doctor. Important aspect over here is psychological support. So psychological support is something which a woman needs from her family members, a support and a comfort that is offered at home, because breast cancer, even though a physical disease, creates a big impact on one's psychology, and therefore adequate psycho-oncological counseling. We have counselors in house in our hospital which help the woman to cope with the stress, and thereby the treatment also works well on her. So psychological support is important. Paramedical science like performing yoga and pranayam also helps in maintaining and controlling stress levels. And other than that, okay, so do we have any questions? Hi. So, hi, Umakan. There's a question. He has asked, what are the symptoms of breast cancer? So, yes. So, first and foremost, symptom of breast cancer is lump in the breast. That is quite obvious. That is in a small size. If the lump is smaller in size, that will usually be felt by the woman herself when she's examining her breast. A painless lump is an alarming sign. Not all painless lumps are cancerous, but definitely a painless lump is an alarming sign and needs a biopsy. Other few symptoms are dimpling of the breast skin. So a lot of women or people have dimple over their cheek. So similar dimpling, if observed on the breast, is one of the warning signs. Any discharge from the nipple which was not there before, any whitish discharge or serous or watery discharge or brown color or blood stain discharge is one of the warning signs. Other than that, itching over the nipple, any ulceration or wound over the nipple, skin of the breast getting pulled in or nipple getting pulled in, or any redness over the breast or swelling over the breast, and change in size of the breast which was not there initially, are few of the warning signs which should be kept in mind when a woman is examining her breast. So there's a question from Vijay Meena, and she asks when we can start screenings easily so that we can identify the risks. So screening, self breast examination screening on your own should start from the age of 20. Radiological screening, that is mammogram, should start from the age of 40 once a year. But if there is family history, the screening starts early from the age of 35. But yes, self breast examination is very underestimated, but it needs to be done from the age of 20, 4 to 5 days after your periods every month till the age of 80 years, and mammogram from the age of 40 years intermittently. So, if you have a family history of breast cancer, it is recommended that you also visit a breast surgeon and get yourself examined at least once a year. That is called clinical breast examination. To understand your risk, there are a lot of softwares available, lot of free softwares available online, Gale model and all those. But basically, any woman in India has a risk of developing breast cancer of around 2.8%, and the best mode to detect it early is self breast examination and being aware of any change in the breast which was not there before. There's a question from Vidhu, and she's asking, will I get breast cancer if I have family history? So, yeah, definitely your risk increases by around 10 to 15% than the normal population. It's not like you will definitely develop breast cancer if there's positive family history, but your risk increases, and therefore you should start screening at an early age. There are. So there is there any genetic test to check family history? Yes, there are a lot of genetic tests. The most common ones are BRCA1 and 2. But it's recommended that you go to a genetic counselor, find out what your risk is, what mutation are we really willing to find out, and then we can perform the genetic test. Those are quite reasonable nowadays, and it helps us to determine our risk and plan our surveillance or follow up in future. If there is genetic mutation present, you need not undergo. So all of you must have must have heard about the Angelina Jolie effect, where she was positive for genetic mutation and she underwent bilateral mastectomy. So yes, you there are two options: either you can do that, or you can just choose to follow up, short term follow up, say every 6 months to 1 year with your surgeon, and be aware that your risk is high. So there's a question in the chat box. If surgery is recommended, how long the surgery will take time? Duration is not much. It's around 1 hour to 1.5 hour is the surgery time. Basically, what is done in surgery is important. So for small tumors, we save the breast. That's called lumpectomy. We only do a wide local excision and reconstruct the breast to match the opposite side. In cases where the breast cannot be saved, say if there are multiple tumors spread all along the breast, we need to do a mastectomy, that is removal of the entire breast. And if it's clubbed with plastic surgery, say creating an artificial breast by using your own body tissue, it might take a little longer time, but it's around say 3 to 4 hours. But the usual duration of surgery is around 1.5 hour. So there's a very good question. If a mother is having breast cancer, is there any chance of transferring the transfer through milk? So breast milk. So no, breast cancer doesn't get transferred through body fluid through breast milk. But yes, if the mother is on certain drugs like anti-hormone treatment, then breastfeeding may be contraindicated. But breast cancer will not transfer through breast milk. Question from Satish: what is meant by stage of breast cancer? So, any cancer usually typically has 4 stages. Stage 1 is when the cancer is limited to your breast and the tumor is small in size. Stage 2 is when the cancer tries to step out of your breast and goes into your underarms, into the axilla, and some lymph nodes or some lump might be felt in the axilla. Stage 3 is when the tumor is larger in size and involving most of the volume of your breast and has also gone to your axilla. Stage 4 is when the cancer has stepped out of your breast and has spread to other organs of your body like the brain, liver, lungs, or bones. So as the stage advances, the survival decreases, the treatment option comes down, and that is why early detection is fundamental. When should we go for an MRI of the breast? That's a question by Vidhu. So MRI is not recommended routinely because it is cumbersome and not done unless there is high suspicion of family history. So if somebody has positive family history, we do a follow up with mammogram and MRI to be sure. Otherwise, just a mammogram and ultrasound suffices. An MRI is usually used by a surgeon if there is any doubt in mammography and ultrasound. An MRI can be offered by the surgeon for some surgical planning, but it is not required in all cases. So, is plastic surgery needed after treatment? So, it is not needed. It might be wished, it might be wanted by the patient. So, the patient might want a reconstruction of the breast. A patient might want a normal contour of the breast like it was before the treatment started. So, it is what the patient would want. It is definitely not needed. But yes, if we are removing only the lump, we cannot leave behind a hollow cavity over there. We need to fill it with something because if we are saving the breast, the patient will go for radiation. And if we leave a hollow cavity there, the radiation will not leave a good cosmetic result. And therefore, it needs to be filled by some plastic surgery technique. However, it is not mandatory. If the patient wishes, we can always do that. So there are no permanent, will there be permanent effects from surgery? There are no permanent effects of surgery as such. Certain amount of hypoesthesia, that is decrease in sensation when we touch that area, is temporary and it usually resolves over few months and with adequate physiotherapy. Also for chemotherapy, effects like hair loss and blackening of nails and eyebrow loss are not permanent. All these are reversible and the patient comes back to normal life once the treatment is over. So there's a question, is breast cancer curable? Yes, it is 100% curable. I should not be saying this, but yes, breast cancer is one of the good cancers because it is curable if detected early in stage 1, 2, also 3. And if adequate treatment timeline is followed according to the prescription, then yes, breast cancer is 100% curable. Breast cancer treatment is nowadays personalized. Not every patients are offered chemotherapy, not every patients are offered the same surgery or the same radiation, and therefore personalized treatment is the way to go, and early detection is definitely required for curability. This is an excellent question. Does pregnancy increase the risk of breast cancer? Well, it's a little anecdotal here because pregnancy causes amenorrhea. So the periods for those 9 months stop, and therefore the patient's exposure to hormone comes down. And therefore, it is also said that pregnancy is protective. But there is a terminology called pregnancy associated breast cancer. So if a woman develops lump in her breast in, say, second or third trimester, or even 1 year after delivery, not necessarily the lump is formed because of breast milk. It needs to be evaluated because pregnancy associated breast cancer is one terminology wherein the cancer is quite aggressive and often misdiagnosed as a lump because of breast milk. And therefore, it's anecdotal. So, yes, any lump in the breast during pregnancy or 1 year after delivery requires proper examination by sonography and biopsy. So, do I need more tests to find out if there is cancer anywhere else in my body? So, there is a lot of tests like circulating tumor cells are detected nowadays. That's called liquid biopsy, where a blood test is done. I don't think that is required. I don't think that is mandatory. We need to keep a check on our symptoms because some sort of cells are daily are formed in our body and then are killed by our immune system. So that so body is a moving machine, and therefore any test particularly to detect cancer elsewhere in the body pertaining to breast cancer is not recommended. For other cancers like prostate and ovary, there are definitely markers that we do, but for breast cancer, I don't think there's any test that is recommended or needed. one interesting question is breast pain a size of breast cancer? I think a woman in her entire lifetime almost experiences pain in her breast during or just before her period. So if the pain is coming and during the periods, if she's noticing pain and it's relieved after periods, that's usually because of hormone-driven changes in the breast. That is fine. So breast pain is not a significant symptom of breast cancer, but yes, it is one of the symptoms, one of the rare symptoms of breast cancer. So it should not be ignored, particularly if the pain is one-sided and not related to periods. So, do you recommend any nutritional supplements or changes to my diet? So, if you see the Indian diet, particularly, it's quite balanced. So, if you eat two bowls of dal in a day, your protein requirement is almost completed. Similarly, carbohydrates are fulfilled by rice and then gluten by. So, a lot of things are included in our diet. No supplements required as such if you follow proper diet. But yes, vitamin D supplementation is required, and because that is something we get only from sunlight, in around 10 to 11 o'clock sunlight, so everybody should step out that time, and vitamin D is something that comes from there. If it's not possible, we do advise vitamin D supplements. So there's a question: Can we save the breast even if the lump is big in size? So that's interesting, and yes, we can do that. That is when chemotherapy comes into play before surgery. So we give chemotherapy before surgery so that the lump comes down in size. That's called downsizing of the tumor. Once the lump shrinks in size, we can definitely save the breast, and we need not remove the entire area of the breast where the lump was present initially. So yes, lump breast can be saved even if the lump is big in size. What is the chance that cancer will come back? So when a woman develops breast cancer, there's always a chance in her entire lifetime for next 10 to 15 years that the cancer might come back. Depending on the type of cancer, triple negative, hormone positive, the risk of recurrence or the cancer coming back varies. But yes, that is why we advise regular follow up once the treatment is over, for every 6 months for initial 5 years, followed by annually. And then we also do mammograms and certain blood tests to make sure that there is no sign of cancer coming back. So I think we have had a wonderful session. A lot of questions have been addressed. I thank you all for your attention and valuable time early in the morning. And I hope all the ladies here would also practice self breast examination once you go home. And breast cancer is also found in men. So that is one fact which I forgot to mention. Out of 100, one man might have the risk of developing breast cancer. Symptoms are same, treatment is same. So yes, self breast examination is the take home today, and early detection is fundamental. Thank you so much for your attention, your questions, and I would be available in the hospital in the working hours for any queries. Thank you so much.